evening, everyone. I'm Kari Wold. I've met many of you at St. Thomas, but for anybody who has not met me, I have been a member of the church for about 3 years. I am by day a psychologist, and I've been in the field just about 13 years. I know originally the handout said 15, and I've worked both across mental and behavioral health. And so my focus right now is working with children, adolescents, and young adults on the autism spectrum, but my background is in a much broader area in mental health. So I thought it would be a good opportunity to share some very just basic and some broad points on some mental and behavioral health related topics, as well as self-care and resources, and just to get the program started. So I'm going to share screen with you all, and okay, so mental and behavioral health, just a broad overview. So again, going to go over a number of topics, just to share some basic information with you all about some of the things that we experience in the field, as well as the community as a whole. So what is mental health? Mental health is defined in a number of ways, and it really depends on who is using it. So if you think briefly, and you can use this in your chat, what is something that comes to mind when you think of mental health? And it can be one or two words. What do you think? Well-being, nice. Emotional well-being, very good. Do one or two other thoughts. Okay, yeah, so those are some of the things that often come to mind. Those are some of the first things that I hear when I ask people, even face to face, is just overall well-being. Some other folks talk about mental health, as cognitive functioning, and depending on the connotation, at times it's viewed as a negative. So it might be, someone's mental health is poor or is deteriorating. And so oftentimes when we look at that second part, we're hearing things like mental illness, mental health disorders, and not just mental wellness. But mental health really does encompass all of those things, both mental wellness and folks struggling with different mental illnesses. According to an article that was published in 2017, mental illness is described as currently or having recently experienced within the past year a diagnosable mental health disorder that is through the DSM-5. That's our diagnostic manual. Some folks, and I would say almost all folks, experience some level of mental health related difficulties, right? So how many of us here have felt anxious, nervous, stressed, depressed at times? We've all experienced it. It's just whether or not it meets that clinical threshold that would warrant a diagnosis. All right, so behavioral health differs from mental health, and that behavioral health really is related to the behaviors that contribute to mental and physical well-being. And so some of those things might consist of things like your eating and drinking habits, exercise, addictive behavioral patterns, and substance use. So in the chat, can you tell me what you think one example might be of a behavior that could positively or negatively impact your physical or mental well-being?
Kari, I'm just going to give a quick instruction. If you can't find the chat, just move your cursor or your finger over the lower part of your screen. You might have to pull the chat window back up while we're in screen sharing mode.
And Gar, since we are a smaller group, if you are comfortable with it, we can also unmute too.
Okay, I can.
And I would be fine with that, because I think that will be very easy to manage at this point.
Okay.
I see Jessica says brain function, I see overeating.
I have
Eating.
opened it up so you all can unmute yourself if you would like to say something.
Feel free to use that as well. Lack of adequate sleep, great. Yeah, so those are all very good examples of behaviors that we see that contribute to the mental well-being or physical well-being. You know, we also look at things like exercising for a healthy outlet. Gambling is one that at times can lead to an unhealthy behavioral behavior that leads to a decline in mental and physical well-being. Emotion regulation, yep, continuous stress, emotional reactions, yeah. So there certainly are too much exercise, yeah, over exercising, yeah. So anything too much or too little of anything could result in a decline in those things. And so behavioral health really focuses on the coupling of those wellnesses. So to discuss just kind of some of the prevalence rates in adults in the United States, we look at two areas, but 2019, 1 out of 5 adults, 1 out of 5 experience some sort of mental illness. So this is a diagnosable mental illness. So 20% of the population. And that's for the folks who actually went and sought help or met criteria. That does not account for the folks that may not have been on the radar. So any mental illness, so there's roughly 51.5 million individuals with any mental illness. So this means an individual who experiences a mental illness, but it may not interfere clinically or significantly with their everyday functioning. Of these individuals, 19.8 million sought mental health services. The rates were higher in women than men. Now, that said, oftentimes in the field, we question if it really is that much higher, or if perhaps women are more likely to seek services, depending on where they are located, their understanding and perception of mental health, among other variables. Lastly, we found in this study that young adults, 18 to 25, had the highest rates of any mental illness, but they also had the lowest rate of mental health services out of the whole population. Now, serious mental illness is different than any mental illness in that it does result in substantial interference in one's functioning. In that same 2019 study, 13.1 million individuals had an SMI or were identified to have a serious mental illness. Out of those individuals, 8.6 million received mental health treatment. So far more individuals in that population went and sought, if we look at percentages, treatment compared to their counterparts in the AMI category. There were higher rates again in women than men, and younger adults again had a higher prevalence than their older counterparts. However, they also again had the lowest rate of seeking. Now, everyone in this group, any thoughts on why that might be the case as to why our younger population don't seek services as quickly or as actively? If you could guess. Access. Yes.
Also the stigma involved in raising your hand and coming forward and seeking help.
Yeah, very nice. Yeah. So access is one reason. The stigma related to mental health and behavioral health that continues. People's perception of being weak, or perception of they don't want to be different. How many of us wanted to be different when we were kids? I would say most everybody would say, no, I did not want to stick out. And if that's a concern, I could see that being a reason. To the chat. Lack of knowledge of resources, yes. Lack of understanding of their issues, embarrassment, all very good things. As a young person, not everyone is in the know about where can I find resources? How do I search for them? Again, they may not have the means. I don't think as an 18-year-old I would have known to call insurance and ask for a referral list because they carry an active list both of in-network and out of network providers. Not something I would have thought of doing at that age. So I would guess it's a culmination of those things. So prevalence rates in adolescents. So this looked at ages 13 to 18. And so in 2019, 49.5% of adolescents reported having or reported to have AMI. So about 50% of individuals. Of the population, 22.2% of them had serious mental illness. So again, that causes that significant interference in their functioning. This could be in home, this could be in the school, in the community, or across settings. We oftentimes do see it across at least one, if not multiple settings. Some of the prevalence rates included things like anxiety disorder at 31.9%, 8.7% were diagnosed as having ADHD, and 5% with PTSD. And so these are just some of the diagnosable disorders that were reported. But again, I'm not entirely surprised about the anxiety, especially with that younger population when they already are experiencing so much change in their lives. So any thoughts so far on any of the numbers that you all have seen, or any of the topics related to just the mental health side and some of the statistics we've talked about so far?
Kari, this is Susan Olson.
Oh.
Ages 13 to 18, do you have any data on ages 10 to 12?
Yeah, so that's a great question. I have done some research on that population, specifically as it relates to suicide. One of the biggest things that I run into when I'm looking at research in that area is there is research, but many of the diagnoses in the DSM, there are age cutoffs. And so one cannot even have it be a qualifier for that unless they are of a certain age. There are also a lot of variables that are harder to account for with that younger group. You also look at things like parent consent. So I would say if I'm comparing age groups, research for the younger population is much harder to obtain because of a lot of the steps you have to go through to get there. There is research, but I do not have data for it for this presentation.
Okay, thanks. I understand the difference between research and one's own patient population.
Yeah, no, definitely. And you're right. And there is, like I said, there's research. It's just even on like the NIMH website, I believe 13 is even the youngest they go on that website for the majority of their data that they share. And I saw that in my own research when I was in school as well. So great question.
Okay, thanks.
Yeah, you're welcome. All right. So tools and resources. So self-care. Self-care. So true or false? Self-care is easy. Any thoughts? Chat, let's see. Not easy. In theory, it's easy. Yes, in theory, it's easy, but it's not easy. And the problem with self-care is so many people neglect to take care of themselves, even when they're wonderful at taking care of others. Self-care is one of those things that, at the end of the day, you're tired, you have 24 hours in a day, and so many of us they just push to the side. But it's so incredibly important to engage in self-care for a number of reasons. So taking care of yourself. So eat healthy, exercise, having healthy eating balance is really what it is. Exercise, engaging in good sleep hygiene. So when I say that, I mean, not necessarily getting 9 hours of sleep a night necessarily all the time, But good sleep hygiene might be that, hey, I'm attempting to lay down and fall asleep between 10 and 10, or 9 and 10 every night, and getting up around the same time every morning, just to let your body have that pattern and routine. Giving yourself breaks when you get stressed out, taking care of yourself. While I'm talking over the next couple points, if you all want to share something that you do to engage in self-care, feel free. And I'm also going to give you a couple of just self-care things that you could do. Talk to others. So share your problems, talk with a religious leader, a parent, a counselor, a therapist, a friend. Avoid using drugs and alcohol. Oftentimes, these exacerbate issues. And so while in the moment they might feel good, long-term they tend to become more problematic than they do actual good. Take breaks. So when I say take breaks, I mean take breaks from the news, take breaks from social media from time to time. We are inundated with information, and that becomes very overwhelming and very overstimulating at times. And oftentimes what we are being presented with is far from happy or feel good. And so make sure you're allowing yourself those breaks from those resources. And then recognize when you need help. So if a problem continues, it's okay to reach out. It's not unusual to hit your threshold. It's not unusual to hit problems that you cannot solve, or that maybe you need assistance in solving. So, yep. So some forms of self-care, this could be anything from very simple. So go for a 5-minute walk, sun on your skin. There's a lot of therapeutic feelings and relief that can actually come from that. Taking a few minutes to, if you have a pet, pet your animal, spend time with them. If you knit or paint or read, things that are just for yourself. I know many of you have children, so even sometimes taking a 10-minute shower alone when you have a younger child, that is self-care. Just giving yourself, again, that break, and allowing you to have time to reset is very crucial for your mental well-being. So to talk about briefly, something else that we oftentimes see in correlation with mental health is suicide. And so in 2018, suicide was the 10th leading cause of death, claiming over 48,000 lives. And this was the second leading cause of death in individuals ages 10 to 34, and fourth leading cause for those 35 to 54. As my slides say, it's 2.5 times the amount of individuals who passed due to homicide. And so suicide is something that affects every community. It is something that is very impactful to the people that are left here. And it's something we experience very frequently, as evidenced by numbers. This particular picture shows the rates by state. And so the dark blue is 19.5 to 25 per 100,000 people. So that just lets you kind of get a visual of the different states, kind of the prevalence rates in each of those states. So suicide awareness, I'm sharing this with you primarily not to have you be the resource to try to solve it, but just to have on your radar of some of the signs that at times do show up, so that if you perhaps see this, maybe it's time for me to reach out to either get more help for myself or someone else that I know. So some of these signs include openly talking about wanting to die. Sometimes this is more covert, like it would be easier if I was not here. Things would be much, much less difficult. People would not be put out because of me anymore. So you hear some of those kind of statements. Looking for ways to do so, having the means to do so. A lot of these things, when they have the means, meaning they have access, is an indicator that they're at a higher risk. feeling helpless and hopeless. And, when someone talks about feeling helpless and hopeless, it's a very dark place to be. And so, things are never going to get better. I'm never going to do better than this. I'm going to keep bringing people down. Those kind of statements are things that we hear. And then a number of other things. So increasing use of alcohol and drugs to numb certain feelings, so it makes it easier. Sleeping too much, too little, being more agitated. There are a number of signs. And again, not sharing this to make you the problem solver as much as to make you more aware. And then what to do afterwards. So there are many resources to help individuals so that they know that this is not the means in which they need to finalize their life, that there are ways to brighten things and elicit hope and build that. So first thing is really just helping them understand they're not alone, but also you knowing that you are not alone. There are many professionals out there, including myself, who work in the community with individuals who struggle with this. There is a hotline, and the number's on the screen. This hotline in particular is a suicide hotline, and they are 24/7. You can access them, and they can help respond as appropriate to the situation, and everyone on that line is professional. So it's a very great resource for folks who are struggling. So a few things that you can do for yourself or loved ones who perhaps need more help. So there are plenty of therapies out there, traditional therapies, if therapy is a route you want to go. Let's say perhaps self-care or those types of things are not working. Let's say perhaps life has just become a lot. And a lot of us have experienced that. I would say most of us have in the past year, where things just become a lot and it feels like a lot. And so if it becomes more than you can manage, seeking more help is okay. So therapy, there's CBT, which is a cognitive behavioral, more of a talk therapy. We look at acceptance and commitment therapies. There are tons of therapies out there. Some people go just because they want to learn more about themselves. Some people go because they know they need to address sometimes shorter term and sometimes longer standing issues. And any reason is okay. There are also warm lines. So warm lines consist of things, they're not crisis related. It's more of like, hey, I'm not quite sure what to do in this situation. I'm needing some help, but you're not in full-blown crisis. And those look different for every situation and every need. And then you do have hotlines like suicide hotlines. There are lines that deal with CPS, so reporting Child Protective Services, APS, Adult Protective Services. There are a number of those. One thing I wanted to share with you all, we have two links on here, but one of them is actually a resource that we created in the mental health ministry. And if it actually takes me there quickly, yeah. So we're going to share this, and we're actually working to post this as well. But this resource has a number of sources. We have everything from alcohol-related resources to suicide prevention to counseling, mediation for families, because family life is hard. The dynamics of families are very different for every family. Gambling, behavioral health, diagnostics. This has a number of things that folks can access and utilize and use as a resource. Everything from calling in to just looking at their websites if you're looking for things. Other ways that you can go about finding resources. If you have insurance, your insurance carrier, if you call and you say, hey, I'm looking for an in-network therapist, meaning they cover services with your insurance, they will provide you a list of carriers. They also usually have those on their website as well that you can access, whether it's in a portal or on their main page, because they want people to be able to gain services for things that are much needed. And so that's another way to go about getting additional resources outside of tools like this. So that said, got done early. What questions do you all have? We can have a little bit more of a discussion. I've got some chats too. Yep. And so Father Gar mentioned going to insurance is a great first step. Sometimes people want referrals, which the church does have, but some are not on insurance plans. Some therapists don't actually take certain carriers, if any. They may be private pay, some have sliding scale fees, but insurance is really a great route to go because they do narrow down some of the options that, like if you were to Google therapist in my area, you would get hundreds, whereas your insurance line may have a much smaller manageable list. Good question. So is the list we were just shown available at our church website? Father Gar mentioned earlier something about, I think, creating a space on the page for this particular ministry, right, Father Gar? He's muted.
Yeah, of course. There'll be a unique page for the mental health ministry. It's still being developed as we get resources on there. But the link to this document can be shared and we can put that into our talk.
Yeah. So we are going to make it accessible. I have made that link available so that if when it's not posted, if somebody gets that link, they can access that page alone and pull information if they need. Any other questions or thoughts, or even questions related to this? So like this topic, and maybe just general information related to this topic that would be a good time to answer. Again, I wanted to narrow this down because mental health is a very, very broad subject. You know, when we look at diagnostics, specific disorders, there are a lot of things that I could actually talk about related to it, but that could actually also go on for days. So that was more of a basic overview. So if you do have questions, I would be happy to answer.
I have a quick question, Kari. I had a relative that was on medication because they were bipolar, and they really struggled with taking their medication and unfortunately stopped, and it did not end in a good situation. Do you know anything about what doctors or people in your field might be looking at where there's not a need for medication because it seems to sometimes cause problems if they're not taking it regularly or something like that?
Yeah, so that's a great question. And so if I'm understanding right, basically more or less, we're looking at someone who is taking medication irregularly, but then again, that results in greater issues. And now whether so whether that is related to a few things, there's a few things with this. Sometimes that happens when, as a result of that med being taken irregularly, because that's actually a side effect of a medication being taken irregularly. Sometimes that's a result of the underlying diagnosis that was being medicated to begin with. There's a number of things. So I always encourage individuals to, if they want to or are thinking of being off of their medication, to speak with their psychiatrist, because there are healthy ways to titrate off without having that adverse effect while being monitored at the same time. The downside, or the other side to that though, is sometimes individuals just do not want to be medicated. Mm-hmm. That does happen. And so there are a number of things families can do. There are ways to call, let's say somebody decides they're going to be off their medication, and the family has concerns, and let's say it's a safety concern. You can always call your local law enforcement office and have them do a wellness check on the person, as a safety check. If they get there and they deem that person is unsafe, they can take them in without their consent because of safety issues. Depending on the person too, families at times can talk to their family member about the concern for them, depending on where they're at in their cognitive functioning and their rationale. That may or may not be effective at that time. I often encourage folks who are interfacing a lot with those family members that there are going to be things, unfortunately, that happen, that can happen with that family member. And so let's say let's say someone you're very close with, reaching out to a therapist yourself and taking care of your own mental well-being, because we have no control over what that person may or may not end up doing. And so how do you manage the situation on your own? Does that make sense?
Yes, it does. Thank you.
You're welcome. What are the ways we connect with people in our lives that we know are in the middle of a mental health crisis or issue? What are the ways we can connect and be with them? That's a great question. So I'll speak briefly to myself. I have had family members in the past who have come to me, and I've had to make a very clear line of, I cannot be your therapist. I'm your family member, I'm your friend, but I cannot be your therapist. It's not ethical, and I'm bound by my licensure and by my board to not engage in dual roles. But one way to be with them, there are many ways. That could look something like, let's say that person enjoys walking and that's their way of engaging in self-care and decompression. Walk with them, sit with them, spend time if that's what they're looking for. There are a number of ways to connect without becoming a mesh. It's very easy. And when I mean a mesh, I mean taking their problems on as your own, and not being able to separate and keep your worlds separate enough that you can take care of yourself. But just because somebody is struggling with mental health related issues, certainly does not mean they don't belong human connection. And quite honestly, I would say oftentimes when I see people who are verbalizing the most that they're struggling the most are the ones that are actually seeking the most human interaction of some sort or another. And that's, when you hear someone, for instance, saying, I'm done with life, I'm done with this, that, and the other. When they've hit that point, what I'm hearing them say is I need something else. I don't want this to be done, and I don't know what else to do. And so then I intervene.
Kari, before you jump to Ron's question, I know that Susan had a question asked earlier that she put on the chat. If one of us talked to an adolescent or young adult and they talked of hopelessness, etc., what should we do?
Great question.
And then after you answer that, I know Tracy had her hand raised.
Okay, so Susan, and I'll do Tracy, and then I'll go to the next.
Yes.
So Susan, that is a great question. If the person expresses hopelessness, I have met a number of young adults who've expressed hopelessness, and I just kind of put my ear to the ground and listen. And I listen for what I'm listening for. And now this is a professional side. So what I'm listening for is other kind of red flags for me. So what other things am I hearing besides just feeling hopeless? But to fast forward though to the last part of what should we do? If in talking to them, they're talking about being hopeless, and let's say they have no affect, they're very flat faced, their intonation is very flat, and they're not this, you don't see this brightness. I would find that concerning, and I would probably find their guardian caregiver express my concern. So I'm stepping out of the provider role now, and I'm just purely talking as a person, as just me. I would find their parent or guardian and say, hey, I've got some concern. They're expressing these thoughts and feelings, and then perhaps encourage the family to seek some assistance. If this is an adolescent of your own, perhaps chatting with them about, the things in their life that are things that elicit hope and worth living, and then talk about the normalcy of sometimes things do get really hard, and sometimes we do feel hopeless, and then again encourage them to have that open conversation about it being normal for people to struggle, and that there are people out there to help during those times. So much so because it is normal, that there are people that are willing to listen outside of yourself and talk and have that greater conversation by normalizing that life is hard and that it's okay to struggle. That's a way to start the conversation.
Thank
Susan,
you.
did that answer your
very much.
question?
Yes, it does. I think, the issues with adolescents or young adults who are not of age to give informed consent are real challenges. And certainly for me as a chaplain, I often wonder, what should I do?
Yeah. And when I, just so you know, like when I'm looking at mental health in children and adolescents, depending on where you're at, I believe the state of Kansas said is 14 for consent on their own for therapy. Although it's been a long time since I've had somebody that young come in, so I may be wrong on the age now because I've not recently looked. But even when I do therapies with younger individuals, I always get consent, so that initial, but then I also get assent. So every time they come in, I remind them of their rights as a client and of my rights and rules and roles as a therapist. But again, I think having just that conversation about it's okay to not be okay.
I think that's, I'm glad to hear that. Speaking of assent, it's my understanding, and I've worked in the clinical trial informed consent field for a long time. We recognize that someone 6 or certainly 7 years old can give assent to treatment.
Yeah.
So that's pretty young, but it's my understanding that we have a lot of individuals, adolescents and 10 and 12-year-olds who are experiencing deep depressions.
Yes, they
But
are.
as a layperson, like as a person who's not a trained psychologist or a chaplain or a priest or something like that, I think one of the things we've known in our school communities, because even though I'm a priest at St. Thomas, in the school communities, I'm Asher's dad or Riley's dad. We have had some of their friends have had issues like this, or they get wind of a student who's struggling. And one of the things that we do is to let the school counselors know, because we're not in a counseling relationship with any of them, and it's just more of a cautionary thing. Or we have our our son will go and say something to the counselor, so and so's having a hard time, or connect with the parents, and also talk directly to the person. Like we engage with the kids and their friends when they're around, and there was one kid who ran away, and we were able to help the family, and it was just sort of a weird thing that happened when he was 13. He just got overwhelmed with school, and fortunately he was only gone for about an hour. But there's just things you can do to reach out, and then kind of helping them find resources, and encouraging kids to reach out to their school counselors. And if one school counselor doesn't work, to insist on going to a different one, or finding what they can. So those are some simple things I think you can do too.
Yep. Agreed. Tracy, your question, and then I'll go to Ron's question.
Yeah, thank you. In your work with young people, adolescents, and young adults, what impact have you seen in the course of the pandemic on them? And then second part of that question, if you can do this also, is to answer what are some things that we, meaning parents and grandparents and friends, can do if we see young people struggling?
Yeah, great. So that actually ties in with Ron's question as well with the pandemic, the first part. I have seen a big increase in the adolescent world. I mean, and honestly, across a lot of individuals with increased feelings of isolation, depression. So many of them, especially our very littles. I work with everywhere from 1.5-year-olds into the 40+-year-old population. That age, so much is being learned. So social cues, facial expressions, smiles, furrows, all of those things, and they lost a year of that. And you add in things that they're picking up from their fish bowls. And when I say fish bowls, I mean their schools. Those are fish bowls for like-aged peers to be learning from, both things that they need to learn and things that maybe they don't. They think, oh, I shouldn't do that because that's not a good thing and they're not going to get a response. They missed a year of that. That social element for them is even so much more important than I would say probably for any other group, to some degree, because so much is gained from their peers. And so isolation increased, feelings of depression increased. Also, a lot of feelings of anxiety have increased. It's, you have a 4-year-old who's very scared of this very scary thing called germs. They cannot see, but they have to wear a mask or it could hurt their breathing. So imagine being 4 and having that fear of breathing in air because there's something I cannot see that could hurt me. So anxiety has really increased across the board. But that has also happened now with adults I've seen too. Many people are fearful to take off their masks in public or get too close. People are experiencing a lot of anxiety about going back to work because they had this structure and setting and now it's being taken away and changed again. And so I have seen those two things increase. I also know that there was a significant increase in suicides that was occurring a lot in relation to the isolation. Many people who never experienced or experienced at such a low level feelings of depression started reporting clinical levels of depression. And I think in some ways, while I don't want that for anybody, I kind of saw that as a silver lining for people to possibly be able to show more empathy for their counterparts who do experience that on an everyday basis, because so many people do walk through the world on a daily basis feeling very depressed. My hope is that things brighten for all of those folks, but I also hope they can use that to possibly empathize more with their other human counterparts. But those are just some of the things that I saw personally, and also was reading research on during the pandemic. I have since had, I am the diagnostician at my job. So I do all the diagnoses for anyone who calls in. And again, I run everything from 1-year-olds to 40+-year-olds. And I have had a very large uptick since the beginning of the year with parents whose children are now going back into school who are reporting high levels of anxiety and depression, and separation anxiety from their families because they're now being taken back away from their household where they have been for 1.5 years. So those are just some of the things that I have observed. Now for parents and grandparents who witness and are observing their child or grandchild struggling, I really do think, kind of as I mentioned earlier, having the open conversations that not being okay is okay, openly talking about the things that maybe are bothering them, discussing emotions being normal. One of the things that I so often hear is you hear people say, "Oh, stop crying, don't cry." Why? Crying is normal. Being upset is okay. Now, if what you're meaning is, "Hey, buddy, use your words and tell me what you want me to know," then give them the language. Help them if they're the wee little ones who don't quite have those words yet. Hey, tell me, use your words. Say, "I'm sad because," "Oh, you're sad because you hurt your arm." Well, I would be sad too. It makes me sad when I hurt my arm. For our older individuals who are still younger than us, again, having the conversation of, do you know what's going on? Or at least, can you tell me how you're feeling? Again, validating those feelings. "Oh, I imagine you are very stressed. That would be very stressful. I would be very stressed. Let's go talk to somebody." Finding, as Father Gar mentioned, somebody who's a good contextual fit. Not every therapist is meant for every person. Find a therapist who your individual resonates with. They connect with them to some degree. They might really want a female therapist, or perhaps want a male therapist, or maybe they don't care. But find that person who's a fit. And not everybody's going to fit every person, but when you do find that fit and they get that connection, so much can be dredged up. And it always gets harder before it gets easier. You will hear therapists tell people that all the time. It gets harder before it gets easier. It does. Some of the things that you experience and explore, they're not fun. That's okay. There's always that light on the other side. So I think having those conversations, and again, sitting there with them, being with them, and whatever that being with them looks like, is the very first step. Great question. Other questions?
Thank you.
Mm-hmm. Did that answer your question, Tracy?
Yes, absolutely. Yes.
Let me check
Hey,
chat.
Kari, could I say something about Ron's question?
Of course.
Yeah, so Ron, I think that's a great question. I can reflect it from a pastoral side, which is a little different from counseling side, but I would say even with what Kari just talked about, that there is a definite, much higher proportion of people who are in at least at a minimum, a mildly depressive state or a malaise related to the social isolation. And then also that social anxiety in terms of coming back. I've had lots of conversations over the last 6 weeks as we've started to open up in the society more, of people just being fearful of going back to work, all the different things. I mean, adults and kids and teenagers and all of that has been there, but also a lot of deep reflection and evaluation on goals, purposes, and dreams and what's next in life, and a lot of self-evaluation. I'm seeing lots of people shift around in very positive ways in their life. So there's a flip side to that, where there's been a year of time to self-reflect and people saying, that used to be really important to me and now it's not so important to me, so I'm going to do this new thing. Or so a little bit of both, where you're seeing just all the issues of not having had social life and ability to connect, and this constant fear and that. And I think it's also cumulative. And now that we're able to breathe a little easier, no pun intended about COVID, now that we're able to relax a little bit and just, especially once you're vaccinated, not to quite have so much fear, I think that 14, 15 months of living in that state has a toll, and maybe we haven't had a chance to process it. So we're also beginning to process. That's kind of what I'm seeing happening. And I mean, I've had dozens of conversations in the last week just about that very thing. So.
And I love that Father Gar was able to give that side, because there are so many helpers across the fields. I mean, we all sit in different places and we're all seeing similar stories and different stories. And so it's nice to hear that as well, as far as getting that side of the field. So other questions or thoughts? Again, this is a brand new for us as far as this ministry, but we're really hoping that we can provide some good information. And as I mentioned, mental and behavioral health is such a big area to cover. And so to cover it in 30 or 40 minutes or an hour would be impossible. And so it's breaking it down into the digestible pieces and then having a community conversation. So often, when people say, well, what would make everything better? Part of it is having the conversation as a community, and people knowing that they're not alone, whether they're experiencing themselves, whether they're having a family member who's experiencing it. And I think normalizing the conversation, so that people know that they can reach out, and whatever that reaching out looks like is one of the biggest first steps that can be taken, to see things progress, and also see all of our fellow people living their very best lives, whatever that looks like for them. Any other thoughts or questions?
We've had great questions.
Yeah, very good.
Yes, very great questions, and responses. And I just want to just tag on a little bit, that our next speaker is going to talk a little bit more about dealing with some of those transitions as we're coming out of COVID. So just so people are aware of that the next time around. So there'll be more discussion about that as well. But this has been great. Thank you, Kari.
You're most welcome. I greatly appreciate all of you coming and participating and getting a little bit of information. I look forward to seeing our other presenters as time goes on. So,
And a huge thanks to Fran. This has been Fran's initiative to pull this group together after a lot of conversations, and we're setting a model for the diocese, but this has been under Fran's leadership. So thanks to you, Fran, for taking the lead on this and getting these things together.
Thank you. It's been a
And the
great
whole
team
committee,
effort.
so,
Yes, it's been
Yeah,
a
there's a
full
big
committee.
team. So.
Yeah.